The topic is child abuse and neglect. We're going to see about the definition and types of child abuse, neglect, prevalence, statistics, probable factors, effects, recording of child abuse or neglect, examining of the child abuse and neglect, parents consultation, infected braces, and child protective agency. Definition for the child abuse is: this is defined as a non-accidental physical injury, minimal or the fatal, inflicted upon the children by the person caring for them. It is an overt act of the commission of a caretaker, physical, emotional, or sexual one. Neglected child is a one who shows the evidence of the physical and the mental ill health primarily due to the failure on the part of the parent or the caretaker to provide adequately for the child's need. Physical, emotional, sexual, and the neglect. This is the most important common factors, the components. Neglect is the act of omission or failure to provide food, shelter, clothing, health care, safety needs, dental care, and supervision. These are broadly classified as emotional neglect and healthcare neglect, including the dental and the physical neglect. Parents petrol sniffing, smoking too much marijuana, forgetting about what the kids need, not helping the children go to school, playing too much cards, not watching, feeding or caring for the kids. Avoid drinking in town, like leaving children for others to look after them, not washing the babies and little kids, not giving your child good food or water, adults bashing each other in front of kids, leaving the babies in the dirty nappies, mothers drinking or sniffing while they are pregnant. These are all the major factors that are causing the child abuse and neglect. Prevalence. A UNICEF report on the child's well-being stated that US and UK rank lowest among the industrialized nations with respect to child's well-being. Child abuse and neglect are the most common in the single-parent families. While case of Indian scenario, the child abuse is more common in the remote and the tribal areas. 50% of the cases aren't reported. Out of 3.8% cases reported, majority of girls are prime victim for the sexual abuse and the boys for the physical abuse. Statistics speaks at least 60% of cases remain undetected. The average age of the detection of the child abuse and neglect is 7.4 years, which is the least one. The reported case in female is 54% and in male is 49%. No age, sex, gender or socio-economic status is spaced by the child abuse. The mechanism by which the adverse childhood experiences the influences health and the well-being throughout the lifespan is: adverse childhood experience, disrupted neurodevelopment, social, economical and the emotional and the cognitive impairment, adoption of the health risk behaviors, disease, disability and the social problems, and the early death. Probable factors like the condition attributed to the parents like stresses, condition attributed to child like ego weakness, the conditions that are attributed to social, cultural, religious and the practices like vectors. There are many factors contributing to the child abuse. One is income problem. One or both parents are unemployed. Too many children in the family. New baby. Married or the mixed marriage creating the conflicts within the family. Young parents with one or more. Handicapped children. Alcohol and or drug abuse. Divorce. Moving or relocating of a family. The intimate partner abuse like a psychological, greatly overlapping the styles of abuse. In case of psychological, non-physical abuse, physical threats, controlling the freedom, destabilization of the partner reality, controlling the behavior, denial of affection, morbid jealousy. In case of sexual one, sexual coercion, sexual assault and rape, physical, non-sexual abuse, hitting, stabbing, punching, battering, severe assault, biting, choking. Affects children with the history of abuse and neglect are at the high risk of psychiatric problems or the disorganized attachment style, which is further associated with the developmental problems and the dissociative symptoms, as well as the anxiety, depressive and acting out the symptoms. Victims also suffer from the different types of the physical health problems later in life. They have fear, depression, and the mental torture. Some reportedly suffer from the some type of the chronic head, abdominal, pelvic, or the muscular pain with no identifiable reason. Children who are physically abused are likely to receive the bone fracture, particularly the rib fracture, and may have broken teeth, burns, laceration, trauma, and braces. Recording the clinical assessment like the history, physical examination, intraoral examination, and documentation. The written observations like number, type, location, resolution, possible cause, and opinion. Photographs of 35mm color photograph, the various ways. On the radiograph, bite marks, saliva should be noted. Treatment and the parental consultation and reporting should also be concerned. The following histories are the diagnostic in evaluating the non-accidental trauma: eyewitness history, unexplained history, implausible history, alleged self-inflicted history, delay in seeking the medical care. Examining the common signs to be observed and examined, like many abused or neglected the children due to the fear, may appear overlaid the vigilant or display a frozen watchfulness starting constantly. There are no spontaneous smiles and almost no eye contact. The dentist should observe the child for lack of cleanliness, for small stature with respect to age, and for evidence of malnutrition. Overdressed children should also be noted. Long sleeves and high neckless skirts or blouse during the hot summer months may be worn to cover the signs of physical abuse. Face and neck should be examined for their periorbital ecchymosis, cigarette burn marks, and hand slap marks. Corners of the mouth are reported with the blinding marks. If moving your child up in the dental chair in the supine position or lifting up motion results in the pain and the trauma is to be suspected. Definitive CA examination. Following the area should be examined carefully for the detailed examination and the palpation of a skull, looking for the hematoma and the cephalottomas. Positive sign of any battle like lacerations, scar, and bruises. Body surfaces that are covered should be examined by lifting up the cloths to the limit they allow. Inner thighs and armpits must be checked. Parent consultation. Once a suspicion is confirmed, the parent should be informed that injury has been noticed. The parental explanation of the cause of the injury should be understood carefully by the dentist. If the findings and the explanation are not compatible or suspicion still exists, the dentist is mandated by the law to contact the appropriate authority or any child protecting agency. Inflicted bruises, human hand marks, grab marks of the fingertip bruises, linear grab marks, crescent-shaped bruises, stab marks like 1 to 2 inches wide, sharp border, rectangular in shape, and of the various length like lash marks and the loop marks. Viscera marks. The viscera-shaped bruises with the borders are nearly always infected when the blunt instrument is used. Circumferential thigh marks, gagging, abrasion. Facial injury like contusion and the ecchymosis, abrasions and the laceration, burns, bone fractures, and bite marks. Injuries of the dentition, traumatized or the avulsed teeth, discolored teeth. If you tell them enough, they will believe you are the truth. Child protective agencies. Indian laws for the child abuse like physical abuse, Indian Penal Code of IPC 323 and 324. In case of sexual abuse, the girl's statutory rape, IPC 376. And in case of boys, which is an unnatural sexual offense, IPC 377. Government organizations and the non-governmental organizations, the United Nations International Children's Education Fund, which is held in New Delhi and Kolkata, Bhumik Sanstha and Shakti. The biggest myth about the child abuse is the dangers to the children come from the strangers. In most cases, the perpetrator is someone the parent or child knows and is often trusted by the child and the family.